Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home. We're also looking after otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, also home tracheostomy care when adults and children are not ventilated. We also provide home TPN, home IV potassium infusions, home IV magnesium infusions, home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management and palliative care services at home. We're also sending our critical care nurses into the home or into a residential aged care environments to provide emergency bypass services. In today's blog post, I want to answer a question from Lisa, who says, "Hi Patrick, I live in Canberra in the ACT in Australia. My husband is terminally ill and is in palliative care. I need to know if you can provide services around IV fluids and TPN management in our home. Thank you so much." Lisa, I'm very sorry to hear what your husband is going through and what you and your family are going through. Yes, absolutely. We have provided TPN at home for IV fluids and for TPN for palliative care, but we're also providing TPN and IV fluids, including IV potassium, IV magnesium, for other conditions such as gastroparesis, intestinal failure, anyone who can't have oral food or hydration. We can do home TPN. Doesn't really matter what the underlying condition is. At the end of the day, we can provide home TPN. Home IV fluids, we can provide central line care, PICC line care, Hickman's line, port management, or we can cannulate the patient as well for intravenous access. So I hope that answers your questions. I also, I don't know your husband's circumstances, but it looks to me like he's quite young, so there may be an avenue for him to get on NDIS funding, or if you have private health insurance, there may be an avenue for the private health insurance to fund this. There could also be an avenue for the public hospital to fund it if your husband is a public hospital patient, because once again, we are freeing up a hospital bed, which is definitely worth some money for the hospitals and for departments of health. It's a win-win situation. And, it goes without saying that your husband's quality of life at home will be so much better compared than in a hospital. Your quality of life will be so much better at home compared to a hospital. If you have a family member in a similar situation, reach out to us here at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. With Intensive Care at Home, we are currently operating all around Australia, in all major capital cities and in all regional and rural areas. We are an NDIS accredited service provider. We are a TAC approved service provider in Victoria, as well as WorkSafe in Victoria, iCare in New South Wales, and IISQ in Queensland. We are also a DVA approved service provider all around Australia. We have also received funding through public hospitals, private health funds, as well as departments of health. And if you are watching this and you are stuck in ICU or in a hospital, or you are at home already and you have insufficient support, maybe the NDIS is trying to impose support workers on you instead of general registered nurses or ICU nurses, we can help you with turning all of that around. We've been involved with the advocacy for our clients successfully from day one. We've been operating now since 2012. We are also providing level 2 and level 3 NDIS support coordination, which is critical in a situation like this to get NDIS funding in the first place. So if you don't have enough NDIS funding, or if you're not happy with your NDIS support coordinator, please reach out to us as well. Or if you are not even on the NDIS and you want to get on the NDIS and you want help with the intake, please reach out to us as well. And if you are an NDIS support coordinator from another organization and you are watching this and you're wondering how you can get nursing care for your NDIS participants, or if you need nursing care for your participants, or if you need an NDIS nursing assessment, or if you simply need help with advocacy for your NDIS participant for nursing care, we can help you with that as well. Please reach out to us. We have been involved in all of the advocacy for all of our clients successfully. And if you are a critical care nurse and you have a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, we want to hear from you as well. We currently have jobs in Melbourne, Sydney, Brisbane, in Albury, Wodonga, Bendigo in country Victoria, as well as in Warragul in country Victoria. So, and if you are looking for regular work, this is for you. If you are looking for agency work where you want to come and go, this won't be for you. We have a tailor-made solution for our clients, and that includes a regular and a stable team. So we and our clients are looking for staff that regularly want to work with us, not for staff who want to come and go. That's just not what we do and what our clients want, and simply we need to be responsive to what our clients want as well. If you are an intensive care consultant or an ICU specialist, we also want to hear from you. And if you're looking for a career change, we are currently expanding our medical team. And if you're an ICU specialist or an intensive care consultant working in an ICU and you have bed blocks for your long-term ventilated tracheostomy patients, for TPN bed blocks, we can help you eliminate those bed blocks by taking patients home, improving their quality of life, freeing up your ICU beds, and you won't even pay for it. And if you're a hospital executive watching this, we also want to hear from you, because once again, we know you have bed blocks in your hospital, in ICU, ED, respiratory departments, etc. Please reach out to us. We can help you, and you won't even pay for it. And all of that you get, again, at intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. Lastly, if you're in the US or in the UK and you need help, please reach out to us there as well. We can help you there privately and point you in the right direction. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, comment below what you want to see next and what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification if you subscribe to my YouTube channel or if you're a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.